Good morning, everyone, and thank you for joining us today. First of all, at the outset, I want to say I join all of New York in mourning as we think about the lives that were lost so senselessly just a couple days ago here in the city at a place known as the Bronx. And it was an incredible neighborhood. I had a chance to go there and meet with the victims' families, and it was painful to watch, but I was so proud of the way that the community came together, and we're going to continue to come together for them. Every elected official, every level of government committed to ensuring that they have what they need to resume their lives and to have all the services they need going forward. And that is why I've put in my budget a victims' compensation fund, but we're also looking for an emergency appropriation at this time early on to make sure that they have the resources, not just the temporary services that they're receiving from the city, which are great, and other organizations like the Red Cross, but also longer term what happens to these families. And that is a concern to all of us, to let them know that they will never be forgotten by any of us. And again, we mourn those we lost, and our hearts go out to everyone in the community. I am joined today by Commissioner Jackie Bray, the Commissioner of Homeland Security, as well as Dr. Mary Bassett, who will be zooming in from far, far, far away, and I'll tell you where she is in a couple minutes. But first of all, I wanted to give our numbers and to let you know what we're looking at. You know, we're continuing to activate and deploy all the resources we identified and have been identifying for months now as part of our Winter Surge 2.0. Vaccinations, boosters, testing, all widely available. And so the main objective, as you all know, is to make sure that our hospitals do not become overrun, and we'll talk about what we're doing with that. But let's look at the numbers. Yes, that is actually going downward. 48,686 positive cases yesterday. Every one is one too many, and I look forward to the day when that plummets even more so. But right now we have an 18.6% statewide positivity. So you can watch the trend line right here, and that's our positive. The 7-day average is a little bit higher, lagging behind, but looks like we might be cresting over that peak. The continuing cases are slowing down. The rate of increase is slowing down, but they're still high. They're still high, but we are not at the end. But I wanted to say that this is, to me, a glimmer of hope in a time when we desperately need that. So let's look at the cases by region, though, because as we've seen throughout this entire pandemic, there are areas that lag behind others. New York City is starting to plateau even more so right now. The 7-day average reflects that. But take a look at the other numbers. You still see increases in the southern tier, the capital region, Western New York, a little bit of a dip there. So these are areas of concern for us, and I'll be talking about especially what that looks like and why we're taking some steps to address that as well. But as far as New York City, that has been a plateauing in a sense that we hope will continue, then start dropping quickly. We had 12,540 New Yorkers hospitalized yesterday, though, and we lost 160 of our fellow citizens here in the great state of New York, and that is very it's a sad number to have to report every day. It's a sad number to have to report. But hospitalizations, as we've seen from the beginning, continue to lag behind where the cases are. People don't get the case and end up in the hospital the next day. These are individuals it takes a little bit of time, and if they can't resolve at home or through a doctor's care, then they end up in the hospital. So those numbers are continuing to go up, but the rate of increase is slowing. So hospitalizations continue to grow, but the rate of increase is slowing, and to us, that is very encouraging. And it's just a constant reminder, hospitalizations are everything to us. That is still a very high number of people in the hospital, and that's what we're going to talk about in a couple of minutes. We want to make sure that people see that this trend, these are COVID-19 patients hospitalized per 100,000. It is still putting too much stress on our hospitals. I showed you a couple days ago the variance in individuals in upstate and downstate hospitals that continues to exist. And look at the numbers here. New York City, high numbers, as well as Long Island, but managed better here downstate just because they have the volume. They have more hospitals. They can do more transfers. They have more options. They can share resources. And that's exactly what we've been asking to do. Upstate, the numbers are continuing to go up, without a doubt. So we think that upstate is about 2 weeks behind downstate. We don't expect there to be any different trend in that. It'd be nice if that broke earlier, but we don't see that right now. And we'll talk about what exactly this looks like. We talked about the percent of cases that are actually truly admitted for COVID symptoms. And you see overall, let's look at the overall, the top line. We're still holding the line on the number of people in the hospital. Pre-Omicron, it was about 27,000. Right now, it's 27,000. So hospital volume is still about the same. So we've not seen a spike in that. But if you see statewide, we can see that about half of them are COVID. 43% are COVID in some parts of the state, including statewide here. 57% are non-COVID cases. So this is a differential. I wanted to make sure we understood and saw what this really means. So diving deeper into these numbers has really been important for us to manage. It does not mean that these are empty beds. This is still a very high number of people in hospitals who need constant care, who need nurses, who need doctors, who need people to take care of them. So, but just to make sure that we have an expectation of what's going on with COVID cases compared to people who are testing positive but are not in the hospital because of those positive numbers. It doesn't mean that everybody's in need of help, and that is still a tremendous stress. If you subtracted out all the COVID patients, obviously our hospitals would not be in trouble at all. We're not at that point. We're still using we're still looking at a situation that we're addressing very seriously. We also talked about, as I mentioned, the variation statewide and the percent that are admitted due to COVID or non-COVID, and the extraordinary variance here, from 42% statewide, 49% in New York City are people not admitted due to COVID reasons. They just happen to test positive while they're only 26% of those in central New York and capital region 24. The concern is these numbers are going to probably shift in parallel very shortly. So here we go. New York City again is the highest, and overall 36% of statewide admissions were asymptomatic for COVID. We've said all along, this variant is less severe, highly, highly contagious, and that is borne out since we first started talking about this. Our first case arrived here, I believe, on December 2nd when I stood with the then mayor of New York. So hospital capacity is a concern of ours because what's happening is we have regions where vaccination rates are not what they should be, infection rates are going up, and the hospital systems are overtaxed. And what you see in red here, Finger Lakes, Central New York, Mohawk Valley, these are areas we've identified overwhelmed hospitals. Now, we've talked about how we used our emergency powers to see selective surgeries in the areas where anywhere a hospital fell below 10% capacity. That's what we did. Sometimes it was 30, 32, 35, dropped down to 21. But what we see now is that we have to take another shift because we have to create regional infrastructure, regional capacity. And the way we can do that is to temporarily cease elective surgeries, not just in the hospitals that are below 10%, but in the neighboring hospitals, because I have to have the ability to transfer people to other hospitals when the hospital that they present themselves at can't handle that. That is why we've taken this step, a regional approach to dealing with hospital capacity, because for the first time, we're seeing this confluence of factors. People getting very sick, people not having adequate hospital space, and that's why we're going to regionalize this and make sure that when anyone goes to a hospital, they have the capacity they need. So this is only going to be for 2 weeks. We assess this ongoing. These are not long-term strategies. I want everything to be short-term, so it gives us the flexibility to adapt and adjust. And again, we do not want to have overwhelmed hospitals, because if you end up at a hospital because you're in a car accident or a heart attack, you still need a bed as much as anybody. And we want to make sure that that's available for everyone as well. So these are the areas we've identified as needing that extra support. Constant communication with the hospital leaders in those areas. They know what we're doing. We told them in advance. We gave them time to prepare. And that's what this is all about, working with our local partners. Also, I mentioned downstate, upstate, a little bit of a difference here. Downstate, we've done very well in terms of capacity. There's so many more hospitals that are available. And I do want to thank our healthcare workers once again, always praised in the past. We have to make sure we do not forget to thank them. They are exhausted. I spoke about what they're going through in my state address just less than a week ago. We know what they're going through, but also the hospitals themselves. And I want to thank the leaders of hospitals like Northwell, Montefiore, NYU, and NYU Presbyterian, as well as Mount Sinai. They answered our call for help. I said, we need more help with capacity. Can you take patients from our overtaxed hospitals in the region? And they have stepped up, and I want to give them special recognition for what they're doing to help manage this crisis. It's the collaboration, which is incredible, and we should not take for granted. So the other way we can help our hospitals, mentioned this before, but let's put an exclamation point on this. Please don't go to the emergency room to get a test. 20% of people at an ER, 20%, And I ask a question, what's happening at the ERs? We now research, we ask questions, we press. 20% are there simply to get a test. So we've deployed testing vans in the parking lots so we can intercept them before they end up going into the hospital and making our overworked emergency room teams have to deal with something that does not require admission. And we have a lot of locations. There's 2,000 locations across the state to get tests. So please do not go to an emergency room, and we'll hear more about how we're deploying resources when I turn it over to the commissioner in a couple minutes. Vaccination update. Okay, now what we're doing, we're trying to get people to get that second dose. Great number, probably nation leading in terms of people getting the 1 dose. Why aren't you getting the second dose? I keep asking this question. What are you waiting for? You overcame whatever objections you may have had. You got that first dose. That's great. But with this variant, it doesn't have the effect. Does not have the effect to protect you. You have to get that second dose. You have to get boosted. So I'm going to keep pressing on those numbers as well. What have we done? We've sent over 763,000 text reminders. We sent out 2.4 million robocall reminders. So please don't block us. It's us because we care about you. We want to make sure you're doing the right thing. And we've actually had some very significant progress in getting the 12 to 17-year-olds vaccinated since the school year started. You can see the numbers there. In September, we really made a push, and now we have 77% have had their first dose. Moms and dads, make sure they get that second dose, and we have 67% already completed. So those numbers should continue to improve as well. This is the armor we need to wrap our children in as they go off to school and go off to play with their friends and engage in after-school activities and sports. So we've been talking about this for a long time, but I want to make sure you have a snapshot of what we're doing here. So part of this was to make sure that when kids went back to school after this vacation, that they had plenty of opportunities to be vaxxed for school. 235 vax sites statewide over a 12-week period. TV digital ads, you can see some of the ads we put out there, some of the visits we've made, some of the efforts. So this has been ongoing, it's been sustained, and we also have activity-free rides to, we've offered all sorts of promotions, a free ride to SUNY and CUNY, that was incredible. Ski packages, the Rockettes, we've been trying to find creative ways to get people, and the numbers have been going up. So we need to continue getting more people. So this is so important because, as you heard from Dr. Bassett on Friday, we are concerned about the rise in pediatric hospitalizations. One important finding, though, and I say this every time, and I'm going to keep saying it because it's that important. 91% of 5 to 11-year-olds newly admitted to hospitals are unvaccinated. Doesn't have to be that way. Unnecessary, preventable, and that's what we're going to keep talking about is how to make sure that we get our kids protected. So today we're launching a new Vax for Kids initiative campaign, and you can see Dr. Bassett there should be starring in a new ad, encouraging parents and guardians to get their kids vaccinated. It's safe, it's free, and it protects even the younger siblings who are not eligible. This is important. Get the older siblings vaccinated so the children who are not eligible yet, 5 and under, are protected as well. And so we're going to show you an ad right now, and you'll see what we're up to.
Hi, I'm Dr. Mary Bassett. As the state's health commissioner, a medical doctor, mother, grandmother, I urge parents to vaccinate their 5 to 11-year-olds against COVID-19 as soon as possible. We are seeing an alarming increase in the number of children sick and hospitalized due to the Omicron variant. Vaccination is simply the best way to protect them. For decades, vaccines have kept our children safe from dangerous and deadly infections. They are one of the greatest public health success stories. Schedule your child's free vaccine or contact their healthcare provider today, and please don't forget to wear a mask. Learn more at ny.gov/vaxforkids.
Okay, you'll see that all over. We're going to continue different ways through social media and television ads to make sure that we have the message out there. The message is out there. I just want to take a moment, first of all, as we've seen what's been happening in other parts of our nation with respect to schools. I am so proud of our teachers here in the state of New York. It's been so hard on them. They struggled through remote learning. They made all kinds of adjustments, their own family lives, having to deal with COVID themselves. And I want to thank them for showing up because they care so deeply about the children that are entrusted to their care. They showed up. We gave them the resources and the confidence they needed by getting out all those test kits in advance, and our Test to Stay program, and getting them literally in the hands of schools so they can make sure that they're sent home if there is a positive case. And they all put our children first. And I just want to give a shout out to our teachers, and we don't take them for granted. We do not take them for granted. So that gets us to how we're going to get more tests to schools, and I'll give an opportunity for the commissioner to talk about this, but we love those planes coming in. 7.68 million tests to schools so far. That is extraordinary. This is a goal we set in just a few weeks ago. It's hard to believe it's just a few weeks ago. We want to make sure that all the schools are ready for children to come back. Over 3 million to New York City schools, 4.6 million to schools outside, and you would not believe the effort involved and the supply chain effort, simply from scouring the country to find where we can get more tests from, putting in the orders, getting them delivered, getting them out there. It is incredible what's been going on here, and I want to thank everybody who's been involved with it. And we have those tests going out. We have more going out to private schools this week as well. So nursing homes, we're going to talk about nursing homes. I told you that we are concerned about our nursing home patients. We're starting to see an increase in cases going through our nursing homes. And again, these are vulnerable individuals, many with comorbidities, underlying health conditions. So we made a commitment, and we've got out 952,000 tests and 1.2 million masks. We want to get those in place before our requirement that people have a negative test before they can walk in and visit, and that's an important way we're going to protect people. So we want to get those in place, and asking people to replace their homegrown favorite mask with a surgical mask, so we have them available at all of the locations as well. So they have to prove a negative test within 24 hours of visiting, or do it right on site. So let me turn it over to the commissioner right now for her thoughts and where we are.
Thank you, Governor. So as the governor said, testing has been a really important priority of ours. We have ordered 49 million over-the-counter tests. We've received 13 million. We've distributed all of those. Another 500,000 are going out today. We want to be really clear that schools are our top priority for access to these over-the-counter tests. We've got 3 million to New York City schools to date, another 1 million going out at least this week. Over 2/3 of all the tests that the New York City schools have distributed have come from the state. We've got 4.6+ million out to the rest of the schools in the rest of the state, and those will be weekly deliveries. We will continue weekly deliveries until our schools are in the clear. For our nursing homes, as the governor said, nearly 1 million tests have gone out as of the end of the day yesterday, along with over 1 million masks. That will support the testing of visitors. And again, those will be regular deliveries to our nursing homes and to other congregate settings. In addition, we have 21 state testing sites that are open across the state. We have 4 more county-run sites that the state is supporting with staffing. Those are in Dutchess, Broome, Oswego, and Oneida counties. We've got 11 MTA sites will be open and testing people and testing commuters by the end of the day tomorrow. 9 are open today, 2 more tomorrow. And last but not least, as the governor said, when we identified the problem that folks were seeking tests in the emergency rooms, we realized that we could help relieve that pressure. We'll have at least 10 mobile vans outside of New York City. New York City has several dozen additional right outside those emergency departments that are seeing the largest crunch by the end of this week to help relieve some of that pressure. And each week, more tests are coming, and we'll get each week more tests out to folks that need them.
Thank you, Commissioner, and for all you do, and please give our gratitude to your team as well. So we talk about tests. Let's talk about how many tests we did. This is incredible. A record-breaking 425,782 tests were performed on the 7th of January. Just as you know, during this Thanksgiving period, we did 182,000, and we thought that was high at the time. So look at, this was all part of our effort to make sure we had tests available, probably more than other states are able to get their hands on because we're very aggressive about this. But also this number of, going upwards of 500,000 tests in one day does not include all the home tests that people are doing, does not include tests that are being offered at other facilities. These are all just ones that have been tested in labs that we operate. So So this is only a snapshot of it, but it is still an incredible. We have more tests per 100,000 than any other big state, according to the CDC, and that's something we're proud of here. And this, just as I showed at the outset, this virus is changing. First of all, we knew the characteristics early on were not as severe in terms of health outcomes, but we also knew it spread quickly and it's very contagious. That's why testing was so important, so people can find out if they're negative or positive. If you're positive, you stay home and you stop spreading it to others. If you're positive, you also know that you need to take care of yourself and rest and get better. And if you're negative, you can go on with your normal activities wearing a mask. So that's important for us to know. But I wanted to talk to Dr. Bassett about where we are and also some adjustments we're going to make at this time. And Dr. Bassett, if you're willing to join us. And Dr. Bassett is in a place I'm a little bit familiar with. Is about 0 degrees
greetings, yes.
About 0 up in Buffalo today. Okay, you're there. And I did have to teach her some of the local customs. At this time of year, you don't say hello to anybody. What do you say, Dr. Bassett? You don't say hello, you say?
Go Bill.
You say, go Bills, go Bills. So I just want to make her feel comfortable. She's doing great, winning the hearts and minds, and I thank her she's such an extraordinary partner to have at my side as we go through this. So, Dr. Bassett, we're looking at some adjustments related to contact tracing. Why don't you give us a little background on what that's all about?
That's right, and greetings. It's 6 degrees here in Buffalo, and
sorry.
It's falling. Yesterday, I was in Rochester, where the hospital leadership expressed a lot of gratitude for the mobile units that are helping with testings outside of the emergency departments. So I'm talking today about contact tracing and the fact that we are changing our approach to contact tracing because of the winter surge. As everyone knows, the numbers of people who've tested positive has been setting records across our state, across the nation, around the world. Even with the welcome numbers today, we are up fourfold higher than we were in terms of the number of positive tests back in the beginning of December. Omicron is very contagious. It has a very short incubation period. And as we've been discussing today, many more people are being tested. So the result is a very large number of people who've tested positive, a very short window for intervention to disrupt transmission, which is the purpose of contact tracing, and break transmission chains. So for all of these reasons, we've been talking with local and county health departments about how we need to leave more flexibility for what happens when someone tests positive or has been exposed to someone who tested positive. And we're moving to more self-management when a person has either tested positive or been exposed to someone who tested positive, and less active outreach by departments. Our guidance remains aligned with the CDC. The reasons for this are, first, that it will help state and local health department staff focus on where we can make the biggest difference. That's in testing and vaccination. We will be providing very clear guidance for the public and for employers. We will be launching a website tomorrow. The website will be ny.gov/isolation or ny.gov/quarantine. And on it, we will have attestation forms that can be used by people who have either been quarantined or isolated for their employers. We're going live with this change on Wednesday morning. We'll be providing question and answer information, frequently asked questions. The big change for New Yorkers is that if you test positive, you should no longer expect a call from your health department. You should instead follow the isolation and quarantine guidance that will be made public tomorrow, and go to our website to get more information on the isolation and quarantine, things that you need to do to protect yourself, to avoid transmitting to others, and to stay healthy. So again, these will all be available tomorrow morning. And back to you, Governor. Thank you.
Thank you, Commissioner, and bundle up, bundle up. So it's great to hear that. Just to reinforce that based on CDC guidance, we are going to be allowing counties to decide if they want to contact trace. We'll leave that optional for them. It's not a requirement. It's just saying that they're not obligated to do it anymore. Should they decide to continue, they're more than welcome to, but this is in response to their request, given that we have 12,000 new cases a day. It is almost impossible to do contact tracing the way we have been in the past. And so everybody knows somebody who's had it, themselves, close family, friends, and so it spreads it spreads throughout the community in a way that it doesn't make sense to tie up the resources of the local public health departments who'd rather be giving out vaccinations and testing so they can move on to other responsibilities. So I just wanted to say, wrap it up. It was a good trend at the beginning of this conversation. I just want to keep you posted on what we're up to. And we have the tools, the vaccination, the boosters, wearing the better masks. If you're not feeling well, please stay home, watch some football, watch some whatever you want to watch, but just be safe. We're asking all New Yorkers. We're getting through this. We are absolutely getting through this. It feels good to not see that upward spike that just dominated all of our slides for such a long time, but this is a very positive trend that we're seeing, and I look forward to to let the public know when we can start rolling back mandates and requirements that were put in place, all in anticipation of this, all to protect people, and we know that those efforts work. So thank you very much, and at this time, if there's any questions.
I just want to ask, do you support, given everything that's going on, an option for people, government workers, to work remotely for the time being? I know there's a piece of legislation before both houses. I'm asking you less about the merits of that particular bill and more generally, are you open to that idea of having a remote option?
Well, let's talk about why you need a remote option. It's basically because you're not able to go into a workplace safely. And if you test positive, you should not be going into work. But now that we have ability to be widespread testing, we didn't have, just think about we were not that long ago. No one could get their hand on a test. They didn't even have home tests. They didn't have any way to measure. And the safer thing was to, yes, bunker down and stay home. Different dynamic right now. So yes, if you have a positive case, you should and you must stay home, get better. And if you don't show symptoms after 5 days, no temperature in 72 hours, come on back to work. But I also believe that we are trying very hard to manage this as well as keeping our economy open, which has been my priority from the beginning. Since day one, I'm protecting the public health and the health of the economy. And when people look back at this time, they will note that we achieved both those objectives in that we had no shutdowns. We were able to keep people going to work, going to restaurants, going to places, with all the enhancements and protection we put in place to build in to keep them safe. And that's why we've been able to not shutter restaurants, hotels, businesses, and that's important in small retail. So my preference, and we'll follow, obviously if there's legislation, I'll look at it, as I always do, with an eye toward what's best for New Yorkers. But my view is that remote work is, it's up to individual employers if that works better for them, but it should not be a requirement.
Governor, Hazel wants me to remind you that I lived in Buffalo for 5 years, so I want to put that on the record.
All right.
Delaware and West Ferry.
Oh, that's a great area.
Great area. Loved it. Elmwood area. My question is about the mask mandate, which you extended in your winter surge to, I believe, February 2nd. Based on what you're seeing now, which is that cases are heading down, but hospitalizations still heading up, do you see a trajectory which would allow you to lift the mask mandate on February 2nd, or should businesses prepare for that to extend further?
I'm going to buy a little more time on this, Andrew. This trend is brand new. I have to make sure that it holds, first of all, and I expect it will, but I'm not going to be guessing in this business. I go by the true numbers, the metrics, the experts. So given that we still have a couple of more weeks, businesses should continue to enforce this through the month, and we'll be giving them guidance, and it won't be real far in advance. I need the luxury of time to make sure that we're doing the right. I am so looking forward to, just so you know personally, to lift all these restrictions that were put in place for the right reasons. But I know there'll come a time, and we will not be the last ones. We're going to be very thoughtful about this. We'll make sure we do this, and I'm looking forward to giving those announcements in the near future. So yes, if I didn't see this trend, I'd be saying not going to happen that soon. I just don't know based on what I'm seeing today, but it is a positive trend.
Governor, is there kind of a data point that you look at and you say, when we reach this point, either the mask mandate or the other restrictions can be lifted, and based on the projections, do you have any sense how long that'll take?
That's a good question, Peter, and this is what we talk about every single morning. We're having these conversations with Dr. Bassett and a large team of people that I'm using as advisors. I don't have a date, and as far as metrics, last fall we were in a very good place. New York City had a 1% infection rate, literally for weeks and weeks. Upstate was higher. We were very anxious when Buffalo popped at 10%, and those seemed like the good old days. We could not have foreseen the scale that this virus has swept the state. Well, what we'll do is we'll talk about regional differences, because clearly what the trends are showing is that downstate looks like it'll be improving. It is improving at a faster rate. So again, I have been very flexible. I have tried not to have statewide requirements unless there was a statewide purpose. So if we start seeing other areas in a different situation earlier, and it's sustained, and that's the main word, is sustained, we can make regional variations in when we can lift these. And that's important. People need to know there is an end in sight. And I'm so looking forward to the day when I can tell them that the end of anything that we've had to institute to protect people's health, but also the economy, again, having vaccination and mask requirements allowed us to keep the businesses open, allowed us to say you can keep having customers come in, you can keep having your employees if you follow these common sense safety measures. So I don't have a metric that I'm going to say, bingo, I'm going to know it when I see it, because I'm going to be talking to the experts, and we'll know, because there's no textbook written on how to deal with a pandemic or Omicron or Delta, anything we've seen. They've been all wildly different in how they've descended on the state, but also how they resolve very differently. We're looking forward. If we start seeing this go down, we're going to be talking about some dates, just not yet today. Julianne?
Yes. There was another variant identified, I believe, in France. Any information on the seriousness of that, or whether it's here, or whether we see something else on the horizon?
Dr. Bassett, do you want to take the question about the variant that's in France?
Sure. Yes. What we have on the variants in New York State is that it's all Omicron, pretty much. The variants downstate have been 95% Omicron or more, and upstate it's now up that high as well, over 90% the Omicron variant, although there still is some Delta. We have not identified the variant that has been reported from France.
We've not seen any of the variants from France.
It's still Omicron.
Yeah, yes. But watching it closely. Again, Omicron was first given its name November 26th, the day we instituted an executive order to give us flexibility in mostly purchasing acquisitions. We can be our way, and that's why we have so much capacity right now with respect to masks and test kits. So that's what we instituted. I know it didn't come here to New York State until December 2nd, and look how quickly it spread. So we watch these trends. We watch them very closely. All right, thank you, everyone.
Now, your first question this morning comes from Dan Clark at New York Now. Dan, your mic is open. Go ahead and open your mic, Dan.
Hey, Governor, can you hear me?
Yes, I can, Dan. How are you?
I'm good. How are you?
Great.
So at the end of the week, the state's eviction moratorium is going to expire. I'm wondering if you've had any conversations with the legislature on a possible extension to that. I know that we haven't gotten the money for rent relief that we were hoping to get from the federal government as of now.
Well, let me just take us back a little bit. Across the nation, the eviction moratorium expired early September. And in my early days as governor, the first week, I believe, I convened the legislature in an extraordinary session to assess where we were in New York as certainly the hardest hit state during this entire pandemic. And we talked about giving people a little more breathing room, giving them just a little more relief on a short-term basis. And that went all the way till January 15th. And so that was something no other state has done to my knowledge. And what we want to do is let people know that that is concluding very shortly. I'm having conversations with the legislature on what to do on this issue, but also there's also another option, which is, reopening the portal, which is going to be, has the same effect in terms of allowing people to take advantage of a situation. If they are not able to pay their rent, they can have a cessation of the eviction proceedings for a time being. So we're very, very cognizant of the anxiety surrounding this, but it has been foreseen for a long time. It is very frustrating to us, though, that federal dollars, and we are number one in the nation in terms of getting out the rent relief money from a time when it was all jammed up and it wasn't getting out there. I grabbed this and held it tight and said, get that money out, get that money out. And so we got out the money, and any money that's not out has been set aside and reserved and committed to situations where we're trying to pair up the landlord with the tenant, and that's the only reason that money is not allocated. So we know exactly how much we have, and as everyone knows, this had to be shut down at a time when the money ran out. The federal government said that they were going to set aside money, leftover money from other states that didn't use it. We asked the Department of Treasury for over $978 million of that money to come to New York to help our backlog, because by then we had probably $1 billion worth of individuals who were seeking $1 billion worth of claims. That money, despite efforts, resulted in $27 million. We just found that out this week. So that's not going to get us over the finish line. Today I'm going to be releasing a letter joined by some of my colleagues in government, including the governor of California, to ask the federal government to replenish the coffers, because what I don't want to do is create false expectations. We can open a portal, people can sign up, but that also hinges on the federal government doing what we want them to do, which is to allocate more money to this pot of money. So that's all tied together, and Dan, it's not a simple answer. They're all tied together, but the porthole will be opening at the end of today. We'll be getting some news on that out shortly. Okay.
Thank you, Governor. Your next question this morning comes from Mike Gormley of Newsday. Mike, your mic is open.
Hello, Governor. A couple items you mentioned from the state of the state. I just wonder if you tell me what you're hoping to accomplish here, what the objective is. One was you're talking about raising the asset limit for earnings and savings, so people could still retain or be eligible for social services. And another one was easing restrictions on residential development around Long Island Railroad and MTA stations. Can you just tell me what you're hoping to get from
Right.
those?
The second one ties very directly to our overall housing policy, which is to increase the capacity and opportunity for more affordable housing throughout the state. Long Island, as you well know, is a very, very expensive place for home ownership. Many individuals who grew up on Long Island don't have a chance to live in the same neighborhood where they were children and went to school because of the prices are so high of the housing. So Long Island all the way up to Buffalo, up to Plattsburgh, and certainly the 5 boroughs, affordable housing is important to us. So what we want to do is also encourage a transit-oriented development. And what that means by its nature, it occurs around transit stations. And we've seen incredible examples of this. I've been out to Wyandanch and others, and we're state money working toward the objective of increasing not just the opportunity for affordable housing, but also commercial development and reusing areas around trains and subways that have been underutilized for far too long. So these are areas where people don't have to have a vehicle to get to work. They can live there, they can recreate there, they can be their home, but also you just want to lift any restrictions and encourage localities to do this. So that's tied to that objective. And the other one is to make sure that we've increased the number of people that are eligible to get services. And this has been a tough hit on all people from all walks of life. This pandemic, as it's winding down, there's still the collateral damage, the fallout from people who have not been able to earn the same amount of income, and so they're falling between the cracks, and so that's what that other adjustment is about.
Thank you, Governor. Your final question this morning comes from Marcia Kramer of WCBS. Marcia, your mic is open.
Good morning, Governor. How are you doing today?
Great, Marcia. How are you?
I have actually 2 questions. The first has to do with your Get the Kids Vaccinated campaign. I'm wondering, give us your best argument to parents about why they need to do this and why it's so important. And my second question has to do with public safety in Manhattan, where the DA has said he's not going to prosecute a number of cases, and business groups and others who function in New York City have expressed a lot of concern about the safety of the streets for them to do their businesses. I wonder if you have any plans to either meet with him or other DAs or something to try to help the businesses understand about the public safety for them and bringing their employees back.
The first answer to your question, Marcia, is a simple number. 91%. 91% of children lying in a hospital bed today who are in there because they have COVID are all unvaccinated. That is why parents should look at their children when they come home from school and say, do I really want to visit my most precious person in my entire life? Do I really want to have to visit them in a hospital today, tomorrow, or in the future? That is the risk that these children are exposed to if they're not vaccinated. I can't think of a more compelling argument as a mother, because that image, even with adult children, it is hard to think of our own children being in a hospital alone, scared at night, wondering why they're there. It's unnecessary. That is what I'm pleading with parents to recognize. They all have to be vaccinated to go to kindergarten. There's not a single child sitting in school who's not been vaccinated. There's no difference. It's just a different timing. And it's not that hard to do. There's plenty available. Please do this for your children. With respect to public safety, my position is very clear. That's why I address public safety in my State of the State address. I acknowledge there's this unease in the streets of our cities and in communities that are just concerned about, is it okay to go to work? As you mentioned, Marcia, we're trying very hard to get people to come back to our cities and come back to our businesses and downtowns throughout the state of New York. It's critically important. And I had a number of very significant initiatives related to reducing gun violence. I also stood with the mayor, Mayor Eric Adams, and I stood together just a short week ago, talking about our joint commitment to reassuring New Yorkers, particularly in the city, that we're going to make sure our subways are safe, deploying more police officers there. I talked about our effort with respect to homeless individuals to ensure that they have a connection to a safe shelter at night so they don't have to be where they are. And so we talked about our overall strategy, and that should reassure the businesses that you mentioned, who I'm in contact with all the time, I hear from as well, and I want them to know that working with the mayor of New York, we are committed to ensuring that there's public safety for individuals so they don't have to have that sense of anxiety. And we're going to get it done. We're going to get that done. So thank you.